Dr. Emma Stokes, President of the WCPT. It's such a pleasure to have you here in Sweden, and I'm glad that you could take the time to talk to us about health promotion.
Oh, look, it's a great pleasure to be here, and I'm thrilled to have the opportunity to speak to the students on this really exciting programme.
Yes, I wanted to ask you, how is health promotion, why is it important to talk about health promotion in a global perspective, and how is it relevant to physiotherapists?
Well, look, you know, the key challenges in healthcare, particularly in many parts of the world, are the non-communicable diseases, you know, and the challenge really is to try and prevent them from happening, to really engage in promoting healthy lifestyles from the time children are very small all the way through later life. So health promotion is a key aspect of physiotherapy practice in a variety of different settings and across the lifespan. The extent to which it is a state of mind or a frame of mind in terms of making every contact count probably depends on the individual physiotherapist. And of course, there are probably more explicit examples of health promotion strategies in some countries. In other parts of the world where the workforce is maybe more challenged, it's probably a little more difficult to engage in those health promotion strategies. But it is a key aspect of our practice. And you know, the expectation is that all of our students, as they leave the programs, would be equipped with an approach to health promotion and not simply focusing on sort of managing aspects of disease and disability as they present. You know, the idea that we can enable and empower people to live healthy lives and that we can have those conversations with our patients every time they meet us is a really important aspect of our practice.
Mm-hmm. And what is the role of WCPT as a global organization working with these questions?
Well, interestingly, I suppose WCPT is the international representative organization of physiotherapists, founded in 1951. With over 100 member organizations. So we are a confederation of professional organizations. We have a key objective of our strategy is to create a global community where every physiotherapist feels connected. So WCPT has 5 regions. The member organizations fit into one of 5 regions, but we also have 25 networks and subgroups. And that's really where the content piece is very much developed. And for those students who want to take this, you know, I guess the concept of health promotion a little further and understand it a bit more and understand perhaps the international perspectives on it, I would commend that you take a look at the network, the WCPT network for health promotion, which is, you know, brings together the physiotherapists around the world who have a real interest in this area. So WCPT promotes the network, we facilitate its establishment and its continued work. If we were to sort of look at our influence and advocacy role, we are in official relations with WHO. So we will obviously be bringing the perspective of physiotherapy, including health promotion strategies, to any of the conversations that we have with WHO. So whether it's around aging and the life course, disability and rehabilitation, physical activity, all of those key areas of engagement, we would be bringing the concept of why physiotherapy is important and matters and is valuable to those types of consultations. So that's our influence and advocacy role. Obviously, we run a congress every 2 years. The next one is in May in 2019. And again, content around health promotion, you know, has really grown in our congresses in the last few years. So I would suggest that anyone who's really interested in this, take a look at our website. We've got a lot of resources there. I also did a piece on you know, physiotherapy and global health for Physiopedia. So maybe again, take a look at that for more resources around these key questions.